Hi. So today I saw a woman for probably the third or fourth visit. She was in her 70s, and she came to me with pain that she had because of shingles or herpes zoster. Now, when I was finishing my medical training and started studying osteopathy, I didn't think that osteopathy was something that you could use to treat shingles or zoster, because that's like a nerve pain problem. And my understanding was that osteopathy was about helping musculoskeletal problems like back pain or neck pain, and that's really why I started studying it. But the interesting thing was, this woman came to me with pain from zoster or herpes, and I've treated her a couple of times, and she's about 90% better. So what's going on? Like, osteopathy is manual mechanical treatment. Why should it have an effect on nerve pain? So to understand this, let's get back to something I've talked about a bunch, which is the interconnected relationship of the three M's. The three M's are our mind emotional part, our mechanical structural part, and our metabolic biochemical part. The fact that all of those parts interact with each other and they meet in the center, and that's where our experience is. So when we think about something like zoster, what is zoster? Zoster, shingles, that's basically a late effect of an infection with various kinds of viruses that live in the nerve. And then frequently when someone gets older, the virus becomes reactivated, and it creates frequently a blistering wound. And in the wake of that blistering wound, there can be this horrible neuropathic pain state. Neuropathic pain meaning like burning, tingling pain where that wound was, but that pain can persist after the wound goes away. So this is basically a biochemical or neurologic thing where the nerves are irritated, the nerves are damaged, the biochemistry inside the nerve changes, so the nerve becomes hyperactive and sends this abnormal signal which experiences really severe pain. And it's really painful, like it can be really bad. So what's the deal? Why is it that a mechanical intervention like osteopathy affected a neurological chemical problem like zoster? Well, again, three M's, everything's interconnected. My body and your body is full of reflexes. The reflexes are there to protect me. We all think of the reflexes as you're in the doctor's office, taps your knee, and your knee jumps. So that's because we stretch the tendon and it causes the muscle to contract to prevent itself from being overstretched. We also have reflexes to protect us from painful things. If I put my hand on a hot stove by accident, wow! I pull it off without thinking about it, because there's a reflex arc in my spine that causes the muscles that pull my hand back to contract. And if it's really strong, if I really have a severe pain, it's not just going to pull my arm back, but it's going to cause my legs to extend and protect me from that, okay? So what happens when someone has chronic nerve pain is that the reflexes that correspond to that level of the spine are responding as if there's a hot stove all the time. So it creates a certain degree of tension and spasm at that whole spinal segment level. What do I mean by a spinal segment? I mean that sensory nerves come in. When people have zoster, it's frequently in the chest. And in this particular woman, her zoster was right in this area years ago. We're talking 10 years ago. When I first saw her, what I saw was that her ribs around that whole area, above it and below it, by about that much, were just like a plate. They were like a rock. They were like a brick. And the spinal segments at that same level where those ribs come into the spine were just stuck and frozen and not moving. She would breathe, and most of her rib cage would move, but that section would just be stuck. And the truth is, a lot of pain was on the opposite side. Why was it on the opposite side? Because the place where the actual zoster had been was completely restricted, and other parts in the rib cage were overcompensating and overcontracting. So she had this dysfunctional rib cage, which is a structural problem that came upon her from years and years of dealing with this chronic pain. She didn't have any nerve pain anymore. What she's got is this structural mechanical after effect of what was a chronic nerve pain problem. The trouble that I see often again over and over is that the average primary care doctor or even neurologist doesn't really do much of a physical examination anymore. So they might hear that somebody had zoster and they had pain, and they just think, oh, the pain's from the zoster. Because they don't get in and they don't actually examine, determine, well, what's really going on with the structure here? Does the physical exam signs add up and match the diagnosis? Is there an area of supersensitivity where the nerve pain was, right? If somebody has a nerve injury in the arm here, you touch them like that, it burns, it hurts, just touching like that. We call it cutaneous hyperalgesia. If there's no cutaneous hyperalgesia, it's probably not nerve pain, unless, whatever, it's a little more complicated than that. In any event, when I examined her, there was no cutaneous hyperalgesia. There was a whole bunch of restricted structure. So there was clearly a difference between the diagnosis she was walking around with and the actual cause of her pain. So she had zoster, herpes, shingles. Over time, it developed into a mechanical structural problem in her back. I treated that with some techniques called osteopathy that enabled me to free up her ribs, free up the muscles, facilitate the nerves at the spinal level, turn off those reflexes so that her rib cage could move and breathe, and her pain got better. I should share the other piece, because 3 M's, right? Mechanical, metabolic, and mind-body. So her mind-body system was a little out of whack too. This is someone with a tendency towards depression and anxiety. And guess what? When I first saw her, with all of her horrible pain, she couldn't breathe well, she couldn't do stuff with her arms. That would be depressing for anybody. But for someone who's 72, who has a tendency towards anxiety and depression, it really evoked that sense of, oh my gosh, what's going to be with my life? I'm stuck like this. And so even though this was a person with a lot of faith and a lot of determination and a lot to live for, she was living in a world that was getting smaller and smaller because she couldn't do the stuff she wanted to do. So we freed up her mechanical neuromuscular restrictions. Her rib cage and her chest wall started functioning better. Did some work on her neck in the areas that started to freeze up there over the time. She feels a lot better. She's going about her life. So that's just a little bit of a lesson, understanding about how sometimes the diagnosis is not the diagnosis. Sometimes a chemical or neurologic problem becomes a structural physical problem, and the two are not able to separate them. You can't really separate the two from each other. And the third thing is how that has an influence and effect on the mental emotional state, and how we really need to think about the whole person and do a really good physical exam, do a history that compares with the exam, and really understand what's going on. So that's the lesson for the day, and I appreciate you listening. If you like this, please share it with your friends. Please also go to the Facebook group called What Heals, WHATHEALS, and join the group, because that's going to be an ongoing, growing resource for inspiration, information, and community support around healing through integrative medicine and the integration of conventional and natural healing therapies. Thanks for joining me. All the best.